Hey, welcome back in. Time for our Ask the Doctor segment today. Dr. Dewey Jones, the fourth, is an orthopedic surgeon from Brookwood Hospital. Dr. Jones, good to see you.
Thanks for having me.
The fourth. All right, so you're from here, grew up here, right? I
did. I grew up here in Birmingham. Grew up here all my life, and my dad's an orthopedic surgeon, so I've kind of seen the business all along.
Yeah, so it's a generational thing with you guys. Glad to have you for the first time on with us today. So we have a caller on the line already, and we have Bob. Hey, Bob, you there?
Yeah.
Hey, Bob, what's your question?
I was asking the doctor what could be the cause. I had a complete shoulder replacement done almost 2 years ago, and I did all of the exercises and everything, but I still cannot lift my right arm up like I can my left one without the help of my left one picking it up.
Okay. Let me, hang on, Bob. Guys, we're having some audio problems. He's not being able to pick the caller up. But he says he had a shoulder replacement 2 years ago.
Okay.
And he is having some trouble with that arm. He can't really lift it up without using the help of his other arm.
Okay, and that's been over 2 years since he's had the shoulder replacement?
Is that right, Bob? Bob, you still there?
Yes.
You said it's been 2 years since you've had the surgery?
Correct.
Okay.
You know, most of shoulder replacements today are very successful. People can usually raise their hand and they can do simple things they weren't able to do beforehand. But occasionally, if there's been some difficulty in the rehab or the exercises afterwards, they won't be able to use their arm the way they were expecting to. I think working with a good physical therapist, getting back into the surgeon who initially did the surgery, and having another evaluation could probably be the most helpful thing for Bob.
Bob, did you do physical therapy after this?
Yes, I did.
Okay.
I've done it twice. The doctor went back in right after he did the first surgery and said that he thought that I had a torn rotator cuff, and he went in and found one little bitty tear, he said, was all it was, and he can't explain why I can't.
So he says
raise
that he had a torn rotator cuff was all that he saw, and he said he had a hard time. The doctor said he couldn't figure out why he was still having a hard time lifting it up. So I guess for Bob, his question now is, what should he do if he's not getting the answers that he needs for himself?
Right. Well, I think for Bob at this point, if he can't lift his shoulder, he needs to see another, possibly another surgeon for an evaluation. If he had a torn rotator cuff, there are certain ways to replace the shoulder that can compensate for the torn rotator cuff. We have a new technology called reverse shoulder replacement, where they actually turn the ball and cup around, and when you don't have a good working rotator cuff, the reverse shoulder replacement can actually help you raise your arm using some other muscles. And you could actually change the original shoulder replacement out and possibly put in a reverse shoulder replacement. Okay,
Bob, I hope that helps you out. Obviously, Dr. Jones would be available at Brookwood if you did want a second opinion with him, or anyone else that would be closer in your community. So thanks, Bob, for calling in.
Thank you very much.
Thanks, Bob.
Good luck. Good luck. I know that's difficult. Do we have another caller, Sandy? Bonnie is on the line now. Hey, Bonnie.
Hey, how are you doing?
Good. What's your question?
I'd like to know, I had about 5 or 6 years ago on my job where I work.
Are you hearing okay?
I used to have to lift heavy money bags. And I did that. And I did it for years. And I had surgery. He said my rotator cuff was just completely shot. A lot of bone spurs in there. He removed all that. I went through the rehab for about 6 weeks, going through that, doing those exercises like I was supposed to every day without fail. Now, just a little, probably about 2 months ago, my left shoulder started hurting again in the same area, the same pain. I really did not won't have surgery again.
Let's let the doctor comment and see what he thinks about just from hearing what you said.
Well, with what you said there, you know, shoulder rotator cuff repairs are very successful for most people. However, over time, if you use those same muscles and ligaments again, it's possible to re-tear through that area. There can be some other conditions that can develop over time as well after you've had a previous surgery. And I think probably starting first with some exercises, maybe again some physical therapy or rehabilitation. If you've kind of slacked off doing your exercises, that may help a great deal. And if that pain is still returning, then you may want to see your orthopedic surgeon again. It may be that something simpler could be done this next time, or it may be that over time the rotator cuff has worn just with age and maturity and has to be slightly repaired again.
Bonnie, you still there?
Yes.
When's the last time you had a follow-up with your physician or your surgeon?
Well, I saw him about probably 3 months ago, but it was for something else, you know, and I didn't even think to ask him about my shoulder at that time because it wasn't bothering me that bad, and now it's got intense.
Well, obviously, since it's her shoulder, and I mean, she needs to talk to her doctor,
She
right?
does. You just need to communicate with your physician. Make sure you're telling them what the symptoms are. Go in prepared to tell them how it's affecting your life. Are you having trouble sleeping, or maybe getting your shirt on, or doing your hair? All those things would be helpful. And then I think with a good exam, maybe some x-rays or a new scan, hopefully your doctor can come up with a new solution for you.
It's not as invasive and bothersome as before, Bonnie. I hope that works for you. All right, good luck to you. We had lots of long questions for the couple that we had today, but good questions. Doctor, good to see you. Dr. Dewey Jones from Brookwood, thanks for coming in.
Thanks for having me today. I appreciate it.
All right, coming up, Mickey